I often solicit questions for our guests in my feed, and I receive something like 12, maybe 15, 18, something like that, questions from women ahead of this conversation, specifically about frozen shoulder. They,
Oh, how
you
about that?
brought it up with the women who come into your office, and there's a 40-something-year-old and she can't move her shoulders and can't put on or take off her bra. And so you can put things together without even having seen her. But can you educate us a bit more on this particular condition and offer some solutions for us with regards to it?
So frozen shoulder or 50-year-old woman's shoulder, which is what it's called in Asia, results from increased inflammation in the body as estrogen is not available to dampen down the effect of a chemical called tumor necrosis factor and a multifunctional molecule in the immune system called the inflammasome. So what happens is for whatever reason, and we don't know exactly why, the shoulder capsule, which I'll define for you, is specifically susceptible to the inflammation caused by inflammation, period. Because men with diabetes can also get a lot of frozen shoulder as well as women with diabetes, but it's an inflammatory response. So capsule, if you think of your shoulder as outside skin, underneath that we can all pinch a little fat, right? Subcutaneous fat. Then all the cosmetic muscles, biceps, triceps, deltoids. Under those are the little rotator cuff muscles that lift our arm. And finally, surrounding our bones is a bubble of soft tissue called the capsule. The capsule is what becomes frozen. The capsule is extremely susceptible to inflammation, which frozen shoulder first presents with severe pain out of nowhere. You did not bump your shoulder on the closet in the middle of the night. You did not fall down. It's just all of a sudden it starts to ache, and sometimes by the next morning, it's excruciating. Well, then you do what is normal. You protect it. You hold it to your side. You don't move it because it doesn't hurt unless you move it. And within a few days, you'll come in with no motion because of the extent of the inflammation, which has caused the capsule to be painful to move, and therefore you won't move it. There are 4 stages of frozen shoulder that my mentor Joe Hannafin outlined in 2011. We've known these stages. It starts with pain and gradually goes through the stages of inflammation until the very last step is capsular contraction.
Mm.
So that you physically can't move it, not because of the pain anymore, but because the tissue itself has contracted. And the reason it can take up to 2 years to defrost, air quotes, defrost, is because of this contraction. Your body has to replace all that fibrotic tissue with healthy tissue. So what do you do about it? Number 1, the first time you feel it, you have to do something about it. The first thing to do is make your hormone replacement decision if you have not made it before. We know from a study done by Jocelyn Wittstein that women on estrogen replacement have lower incidence of frozen shoulder than women who don't. Number 1. Number 2, you have got to keep it moving. Your instinct is to rest it. That is the wrong instinct. Get to your physical therapist. Most physical therapists can see a patient 12 times before they need a doctor's order. So just go, move this arm, get it moving. Number 2, go see your orthopedic surgeon. It is very helpful in this instance when it is so painful to put a steroid injection in the shoulder. Now, I'm not a big fan of steroids, but in this instance, it can be incredibly helpful to facilitate moving in physical therapy. If we still have trouble getting it moving, the longer it doesn't move, the longer it's going to take to defrost, is to use something like platelet-rich plasma, which is your body's own growth factors that I harvest from your blood and inject it because that is an amazing anti-inflammatory. Because what we're trying to avoid is taking you to the operating room and either manipulating you under anesthesia, which means moving it when you're asleep so it doesn't hurt, or making incisions to open this really tight capsule. We don't want to get
Wow.
there. I'm a surgeon, but I'd rather that not happen for you.